Longevitix envisions a world where every clinic, regardless of size or specialty, can deliver personalized, proactive care that helps patients live longer and healthier lives. Now, the company says it is driven by the idea that preventing disease is just as important as treating it, and that the power of science, technology, and compassionate medicine can transform how we care for ourselves and our communities. With me is the co-founder and CEO of Arditi. Welcome to New York. So great to have you here.
Thank you so much.
Walk us through your background and the company, and what is the mission?
Right. So I think I'm kind of a biohacker since I know myself. Goes all the way back to my, teenage years when I was kind of reading biology book just to understand how to optimize my performance based on lifestyle interventions and stuff like that. And it was in the background all the time. And in the recent years, there was kind of amazing advancement in science and biology that led us to understand that the kind of root cause of all chronic diseases is the biological aging process. And we now also understand what is the root causes of the biological aging process. And so there are now treatments that kind of target biological pathways that enable us to slower the pace of aging, but more importantly, postpone the onset of chronic disease and increase our healthy lifespan. So with that in mind, that was kind of my passion in the past, I would say even 30 years. A couple of years ago, I moved a house, and we talked about it earlier. And I went to kind of meet my new primary care physician. And in the first 60 seconds of our conversation, he told me, listen, I don't believe in tests. And I think that every person should be tested every 5 years. And you should just live a healthy life.
Okay.
And then I said, okay, dude, we have a serious disagreement here based on everything I know. And so I got to realize that our healthcare system was never designed for prevention in first place. And with all the background I have in kind of the tech industry and AI and product, I decided that now is the time to make a change from the inside, and here we are.
And here you are. So, and how I understand is you're using AI as well as just preventative care to kind of change and transform the way that we approach healthcare. So how does it work exactly?
So to understand how does it work, we need to understand what's broken first. So when you go to your doctor today, it's a very transactional encounter, I would say. You come with a symptom, something happened. If you get diagnosed, it's very specific, single modal diagnosis. You get medication, you go home. Nobody expects you to come back ever again until something happens again and there's another symptom. And so in the preventive world, it's not like that at all. So you come perfectly healthy to your physician. You're being sent to all these specialty labs, genetics and epigenetics and microbiome and hormonal and functional and cognitive, and dealing with all of this data is extremely complicated. So what we do essentially is we take all this data, we make sense of it in a very nice comprehensive medical summary, we interpret that, and then we come up with the right recommendation for personalized intervention plan for you to systematically reduce your chances to any chronic disease 20 years out. So the system today was never designed to do that. It's not like your health risks accumulates over the years. And so right now it's kind of an annual snapshot, and nothing helps you kind of prevent chronic disease and that's exactly what we're focusing.
Okay.
So, yeah.
Now, we have seen OpenAI and Anthropic and Amazon just announcing AI, technology, healthcare. What do you think that says about the space that you're in? And do you see that as an affirmation of what you're doing or a competitive threat?
So first, I love that. I love it because we're seeing that many more people get access to what's kind of in the past was very difficult. Now you can see people in rural areas or in places that they don't have access to modern healthcare now get access, and they can do diagnosis even if there's not kind of a specialty doctor there or whatever. And this is great. But solving the general purpose solution is very different than solving a very specific solution. That's what we're actually focused on, the longevity medicine and the longevity and the evidence-based preventive care. So first, this is kind of our what we kind of emphasize our outputs of the model. But on top of that, you have the entire clinical workflow that nobody's taking care of. So we are kind of embedded and integrated in the entire kind of clinical workflow. Everything from the first encounter and patient enrollment and intake questionnaires and managing the roles in the clinic and doing the right diagnosis with the right emphasis on what's important for the physician, all the way to connecting physicians and patients with communication channels, real-time wearables integration, and kind of empowering this patient-physician relationship, which nobody takes care of right now. Yeah. So it's really being there in the entire kind of clinical workflow. And these giants, they're not there. So that's exactly our focus.
Now, there's a lot of companies in this space and various entities. What's the moat around your company that makes it more difficult to come in and do what you do?
That's a great question. So there are two things that are really top of mind for us. One is the medical depth that the system provides its output upon. So the first thing we do, so we've curated and we're still curating kind of best-in-class studies, research publications, data sources that tune our models to provide the right output that is specifically for longevity medicine and evidence-based preventive care. So this is first thing. Now, on top of that, we are really kind of providing like end-to-end solution for the physician, which we also kind of provide them the ability to configure the entire system. So the thing is that today, it would be very hard for you to find any provider that loves their EMR, for example, because every clinic is different, and they have their own kind of workflows and methodologies and specialties, and they want to customize their kind of patient journey and their report structure and their reference ranges and all of that. So we are kind of, we put configurability as first-class citizens. So every clinic can really feel at home that the solution fits right to them. And on top of that, the second part is building an kind of AI architecture with a safety in mind, which means that we have the right guardrails to make sure that the system does not hallucinate and does not kind of deviate too much from the standard of care. So there's almost no day that passes by that you don't read in the news some kind of an AI recommendation that went south, kind of everything from kind of suicidal things and all the way to inconsistencies. And when I'm talking about inconsistencies, I'm talking about you ask same question with the same data and get different answers.
Interesting.
And we put all the guardrails in place so our systems do not hallucinate, provide consistent data, and make sure that we are working in the standard of care and not taking any kind of huge risks. And we're doing that by having these kind of deterministic models that constrain the probabilistic LLM outputs to actually work in the boundaries of where we think which is safe. So there are kind of a lot of kind of safety and guardrails all the way about that, and we'll provide that with the complete kind of traceability and kind of and a system that can actually go back to the source of everything. So even if the system fails, we know exactly how to actually find that and how to fix that in the future. So we have like the full-blown kind of medical grade, very deep, and also AI safety systems in place. And both of these make us very, very proud of the solution.
Okay. And data you can actually trust. So,
Yeah.
right. Now, you are in some clinics. So what has been the feedback so far? And have you gotten any kind of surprising or data that's particularly valuable?
Yes. So there are a few things that I think I can remember. So there was one physician in a clinic that was kind of at their very beginning, about like 100 patients, that after using our system for a few weeks told us that he believes that he can now kind of almost double or triple his patients panel because we save him so much time. It's between 5 to 10 hours per patient.
Wow.
We had a physician that tried our system uploading her entire clinical history and told us after we generated her report that she couldn't believe it, but that she learned new things about herself. And this is what she does. So the system can actually cross-connect modalities, which a human find it really hard to do. So, and there are many things. I had like one physician from Europe told us that she's daydreaming about a product. And so there are really great feedback from the market so far.
Interesting. And it's interesting how it's giving you ideas and information that you didn't have any other way.
100%.
So now there's the DTC disruption. So this direct-to-consumer service, like Function Help, that does put the lab data into the hands of patients. So how do you bridge that gap with the raw data sets and the actual clinical outcomes?
Yeah, that's a great question because there is a huge spike in services. Function Health is, I think, the biggest among all of them that really make lab work accessible and affordable to everybody. Now, as a patient consumer, you go to these services, which are great. You get this kind of lab result of 150 biomarkers, and it's great, and you get a nice interpretation. But if something interesting comes from these results, then what happens? And you see a huge trend of people taking their Function Health results and go back to their primary care physician, who usually tells them, like, half of this is not covered. The second half, I'm not sure I understand. I don't have anything, I can't help you. So you're basically left by yourself with a very nice lab result. But if you want to do lifestyle interventions, prescriptions, medications, supplements, whatever, it's very hard. And that's exactly where a system comes into play, because we're enabling almost any clinic to become like a small Function Health and providing the physicians the tools to really go through this process with you as kind of in collaboration with you, the patient. So, and we believe that this is where the magic happens in the physician-patient relationship here.
Okay. Now, what about clinics that may be interested in implementing your platform? How easy is that? How do they even start the process?
So we design our platform to be as frictionless as you can imagine. If you're a new clinic that wants to onboard, it might take you between 5 to 10 minutes, believe it or not, end-to-end to onboard to our solution. So we don't ask you to switch your EMR, to migrate all of your clinical data. You can just open an account, add a patient, upload their data, and within minutes you get a full report and you can actually work with them. So frictionless, the most kind of amazing experience that you can imagine.
And what about from a patient's point of view? What kind of value are they getting as part of this AI-driven healthcare?
So this is a dream come true for me. This is why we're here. So at last, you can have full transparency for your entire healthy lifespan process end to end. You have full transparency for all of your health risks, how to mitigate them, and you have an amazing partner, the physician, that now gets best-in-class tools to help you achieve that. So it's kind of this is the new thing that is going on. So now you can really take control of your health with a partner.
Yeah. Now, we're here at the New York Stock Exchange. What do you see your roadmap? Would an IPO be perhaps in your future at some point?
So we're not taking that far right now, but our goal is to essentially influence as many lives as we can, starting for the physicians, because as you know, happy physicians are better physicians, and obviously patients as well. So our goal is to launching hundreds of patients within a year or two, 1,000 or 10 of thousands of patients, and take it from there.
Yeah. And then finally, I mean, how do you see, kind of from a macro perspective, how will healthcare look in the future? How will health and tech intersect? I mean, what can we get used to as health consumers, and how will that impact the economy?
So the overall thesis here is that preventive care is going to be the standard. I don't know if it takes 2 years, 5 years, 7 years, but there's no way around it. If you look at from a macro perspective, there's 90% of the entire 5 trillion health economy in the US is spent on people with chronic disease. Mm-hmm. And with the aging population, the 50% of the people with at least one chronic condition, it's not sustainable. It has to change. And so the technology is here. The access to data and tests is the best that it has been. And the mindset is here for physicians that know that if they don't adapt, they might be less relevant in the future. So I think we have the perfect storm right now to make this change happen. And I think the future is amazing around that.
Okay. Very interesting, Epi. Thank you so much for coming in.
Thank you for having me.